Hello and welcome back to another episode of Let's Talk Climate Change Conversations. It's a real pleasure to have Professor Ajay Bailey, Chair of the Health Inclusion and Development at Utrecht University. Ajay and I met earlier in March this year, and when I heard that you were in Bangalore, I just wanted to pull you straight into this conversation series.
Thank you for having me. Happy to be
Great.
having this conversation.
So Ajay has a very, very interesting background because I think he grew up in Dharwad, did an undergraduate degree in Karnataka University, then did a master's in anthropology, then a second master's in Europe in population science, then did a PhD in demography. And now you work at this intersection of planetary health, societal well-being, public health, aging, and in diverse countries and contexts, Africa, India, Curacao, Netherlands. So that we should have a wide-ranging conversation. We have a lot of young people that listen in. And I thought it would be very interesting there for them to hear about your trajectory, which I think is extremely interdisciplinary and very fascinating. So,
Thank you. I'm happy to share, Sarah.
great.
Yeah.
So maybe we'll just start with where did you grow up and what kind of an environment was it?
So interestingly, I was born here in Bangalore, and I spent a lot of the summers here. So and then I was brought up in Dharwad, which is north of Bangalore. It's a university town. I went to school there and started studying for my undergraduate degree in anthropology.
Why anthropology?
Yes, so it was a happy coincidence in the sense that you had to choose when you do a bachelor's there, you had to pick up 3 subjects. So I picked up economics, political science, and I had to choose a third option. So I had to think about either criminology or geography or anthropology. And then I spoke to some of the seniors who were there in the college, and then they said, yeah, take anthropology. You may like it. At that point, I had no clue that it would end up defining my career in that sense. But that was a starting point because it made me curious about, it's about studying tribal groups or it's studying people different to us. And that started this whole understanding of who are these other people, why are they different among us, or why is one person different to the other? Because in anthropology, you can study both the biological part of it, but also the cultural part of it.
So it's very interdisciplinary.
It's very interdisciplinary to start off with in that sense. So that started that process in my undergraduate degree. And when I wanted to do my master's, I wanted to focus more on medical anthropology. And Pune was the only place where medical anthropology was taught. And that was also a place where they very seamlessly combine biological and cultural or sociocultural anthropology and the application of both these parts.
So in India at that time, I'm just trying to think if you were in Dharwad, how would you know about what Pune was doing? I mean, it's because that they had this classic connection between Dharwad and Maharashtra? Or?
So I went around and spoke to a lot of people, asking them, where would you go to do anthropology? Because I could have also just stayed in Dharwad, did anthropology there. But I wanted to do something different, something that was more challenging in that sense. So I applied to Pondicherry, to other different universities where anthropology was being, the syllabus was being innovated and the new kind of techniques being taught. So through one of the professors, I learned of the different universities, and then I went and approached these universities, asked for had a look at their syllabus. So so in that way, because for a master's, you're going to spend 2 years in this master's, and you need to really not just like it, you need to love it because it needs to bring that passion out of you to do it. And I was very happy I went there.
I'm just thinking also in those times, I'm now thinking back to when I was doing I went to IISc for an integrated PhD in ecology, and it was the first batch. But that was super competitive, so I didn't, you never knew whether you were going to get something. It's not something you can rely on. And it was so difficult in those days, right, to find out, even in Bangalore, and I'm wondering about Dharwad. Of course, your father was in the education profession, so you probably had access to a lot of information.
Pre easily accessible internet. So I did my master's in 2000. So you had to go to a internet cafe to to book for a half an hour slot to search for stuff and everything. But in those days, people still had time. You could call people up. They would explain things to you. So I called a lot of people, and the Indian system, someone who knows someone who knows someone. So then you try to go through those networks to find out more what do they teach and why I would like to go there.
And every time I've done these interviews, it seems like serendipity plays a lot of a huge role in the lives of, I mean, who we choose to become, especially if we follow interdisciplinary paths.
Yeah.
But I'm also thinking maybe it's serendipity because you open yourself up to the chances that life takes you in. If you are, there's someone who said, I don't remember this old thing that said, I was looking for the truth came and knocked on my door one evening and I opened the door and said crossly, go away. I'm looking for the truth, and truth went away. So it's like that, no? If you're open to something, you pick it up.
Yeah.
And
I don't know whether it's a Karnataka thing or a thing, but very few Kannadigas actually go out.
That's true. Yes.
So we're very content in where we are, and to say like, oh, you want to do out, then people would ask you, but if there is a master's already in your city, why would you go to another city to study, right? And that at the back of my mind already felt that you shouldn't be complacent. You shouldn't be too comfortable with this. You need to challenge yourself.
So you already had that. So was moving to Pune difficult?
It was difficult because it was also the first time I was living away from home, and was also a time where I think in Dharwad, some of us, we understand a lot of Marathi because the Kannada has a lot of Marathi influence. But it was still going there and totally being by yourself, and but it was a huge learning experience for me. I think as an academic, but also just as a young person, who gets to manage his time. You can't or manage resources, money, for example. Many of your students also may experience this, that they're first time out of the house and they have to manage within these limited resources. And with the focus that you're there only for 2 years.
Yeah.
Right? And then you have to think what's going to happen next after this. And social sciences, or anthropology for that matter, was not a widely known field.
No, it was not at all in India.
So my father didn't know what it was, or why would I do that instead of doing economics, for example, which was more of a traditional path you would go.
More job oriented.
More job. Can do something with it, kind of a thing. But it in that whole process of finding this discipline and going deeper with it, it was making sense for myself, but also making sense to others whom I was explaining why I'm studying anthropology and what it brings me, and what kind of options do you have after studying anthropology.
Did you do any research projects then? I mean, what was the thing that stood out in your master's for you in medical anthropology?
So it was a 2 years master's compared to Netherlands, where it's always 1 year. So 2 years really gave us a very good grounding in the theories and the techniques of anthropology. In the first year, they take you and leave you in a tribal settlement for a few weeks. And there if you speak the language or you don't speak the language, you have to learn. I learned Marathi like that because you're forced. You are out there, and I had to do a study on child growth. You can't enter a woman's house, an unrelated male getting into someone's home, and ask them about their child if you don't know the language.
Exactly.
So I worked with the Anganwadi worker, and I went house to house. I would sit outside, and the Anganwadi worker would go inside and measure the child or ask when the child was born and all. So all of that, and we lived in a government school for those weeks that we were there. During the school, we had to be away. And in the evening, we could sleep on that there. So those were really formative experiences, because you are still in your own country, and now that I think of it, but you're in a very different context, and everything that you observe doesn't immediately make sense, but in the grander scheme of things, you're trying to put things together as well.
I think it's also, we find that with our students, and I certainly remember that with my first field work, when you go outside, especially as a city person, you learn a lot of humility and you learn a lot of gratitude for life, I think.
Yeah.
Because you look at people who have very little and they share so much and they do so much with what they have. And then you come back and realize how much you take for granted in your everyday lives.
True. And also, every home we visited, even if they have limited resources, they would still, offer you tea, or if they were having lunch, they will share that small lunch with you. And as one of the core things of an anthropologist is you never refuse food that is offered to you, because that is the closest rapport establishment that happens between you and your participant.
And was that when you first got interested in health and sustainability, or would you say these are early childhood interests of yours?
I was originally interested in health in terms of looking at inequalities of access to healthcare, actually. And because I found health and well-being to be such broad concepts that um, that somehow the inequalities in accessing to these services, inequalities in accessing care, for example, that underlies most of my research projects, actually. That core need to think about social justice issues.
So equality and inequality bothers
Both
you
those.
fundamentally?
Yes, yes, yes.
And if was it, I mean, post, let's say, undergrad masters, or is it something that you think was there through childhood, through earlier childhood experiences?
It has been through earlier childhood experiences as well, wherein I have seen around me. Now, of course, I come from a privileged background. Both my parents were working, so I had uh, a comfortable life. But I also saw around me children or people from my school who didn't have those facilities, and what kind of issues that they faced, or the domestic help who came to a house and how her family was affected by things. So at that point, maybe I didn't really think of it, but over a period of time, all those things accumulated to think about these kind of intersectional issues where inequalities kind of are not don't come in one go but are accumulated over the life course, actually. So that was the start of that.
That was the start.
Yeah.
And then, so you finished your masters and then decided to do second masters? How did
Yeah, no. So my father's, I come from a middle class background. So my father said, you can study to your first masters, but that's all that we can afford. If you want to study further, you need to look for your own resources. And I think these are also issues other students also face. And then in the last year of my masters, I was only applying for master programs or PhD programs abroad. I wanted to do a different master's because I also wanted to move out of anthropology into a related discipline. So I wanted to work on reproductive health. So I was looking for medical anthropology or population studies and this kind of things. I got into many of these things, but in many places they give you partial scholarship and it's unaffordable to go to the UK. And the place where I got in Netherlands, it was the University of Groningen, and I got a full fellowship to go there. So yeah, that was my start. I didn't know much about the city or the university. I had this belief that this is where it'll challenge me more, because I was literally shifting camps or tribes in that sense, because I was going from a completely qualitative background to a completely quantitative background. Yeah.
And did the economics part of your undergrad help in that sense? Or?
Not literally. I also did partly statistics in earlier, but no, I think population studies in that sense, the way that it was taught in Groningen was also this combination of theory and data and, focus on the global south, and all these elements were coming back together, because demography by itself doesn't have a large theoretical base. It borrows from other disciplines. So you also bring in your own anthropological skills and other things into that discipline. It teaches you a lot of tools and techniques. A lot of the way in which I do my qualitative research now is shaped by demography. If I had not left anthropology and gone into this other discipline, I would have been very comfortable doing only the work that I think would be important, since like this is how I do it and this is it. Whereas when you move into another discipline, the other discipline questions the choices you make.
So you become problem informed rather than method informed.
Yes.
Yeah. That's true, because I think of, again, just to come back to, little bit of this, looking at parallels.
Yeah.
I did an undergraduate degree in microbiology, chemistry and zoology. I did a master's in, it was an integrated PhD in biological sciences, but mostly, let's say, a master's in molecular biology. So we called it biology.
Yeah.
Then I moved to ecology. And so I came with absolutely zero training, which is a problem in one sense, but I feel in a way, because it leaves you method agnostic. You don't come, like you say, with a set of methods. You come with what does the problem want you to do and where do you go to it.
Yeah.
But you said something very interesting. You said that if because you work, because it was most of your work is now demography informed the population, informed by your work on demography. Can you give me an example?
When we do qualitative research, a focus as from an anthropological perspective is to understand people's motivations for behaviors. We don't make judgmental things. We say that they should do this, but rather trying to understand what is the context in which people's behaviors take place, be it pro-environmental behavior or health-seeking behavior. All these kind of things has a cognitive background behind it, which motivates people to participate or not to participate in this. Whereas if I would have stayed only within anthropology, I would have focused only on the context and described it. In demography, they go a step further to ask what is the evidence, or how do you construct the evidence systematically to come to this conclusions, and from this, where do you go next?
Again, that I find it very interesting. So one of the so when I did my ecology, it was more quantitative ecology, remote sensing, statistics, biodiversity. And then I moved to Indiana University to work with Eleanor Ostrom, and we were looking at governance data. And my first discomfort as a quantitatively trained, scientist moving into the social sciences, it's sort of an opposite journey in that sense from you, was how do I say these are not just so stories? Because I have all this complex data. I am picking one narrative, but what if you came along and saw the same data and picked another narrative, for instance? And I know I'm sort of selling the narrative very well because it's my story. But what if you had a different story? And I guess I have come over several decades now to deal with this discomfort in two ways. One is to triangulate. So I come at it with ecological evidence, social science. But another is to say that maybe it is valid that Ajay will have this view and I will have that view, because in reality, the world is complex. Our views are part of what make that diversity or difference in perspectives is important. I think as science, we believe that A causes B in this very linear way. Something's probably wrong with that simplistic notion also.
There can be so many different multilinear kind of associations that can exist, right? But I think for me, it has always been that working with public health professionals or health sciences, you have to always balance this between qual kind of a background, because at the end of the day, they are service providers. They want to know at the end of the day, so what will benefit this population? What do I do? What do I do with this information? So how do I translate, be it quantitative or qualitative, into actionable inputs? And what can that contribute back to practice? Be it in the doctor's chamber, like in the clinic setting or in the community setting. At the end of it, within health sciences, it has to come back into that. So your analysis, your mode of theory construction, your mode of describing these more complex behaviors, at the end has to also, not to simplify it, but to show the diversity of behaviors that can exist.
We teach in both our undergraduate and master's courses, qualitative and quantitative methods, because we believe for sustainability, you need to do both. But very often in the Indian context, many global contexts, but definitely in the Indian context, we tend to be you have a science-based university which is known for its science and quantitative is strengths, or you have a qualitative kind of approach in a more social science oriented university. So we get students who come with that bias sort of forced into them by the educational system. And we often get them resisting, especially in the master's level. Some will love the quant and say that's all that gives them insights and qualitative is meaningless. And some will love the qualitative and say that this is what you need, rich lived experiences, and quantitative is all bias filled. So I don't know, have you had those experiences outside while teaching or no?
I spent 15 years in demography, in the demography department. And that, as I said, it shaped how I do qualitative research in a structured manner compared to other particular groups. I would say they look at it that we're doing qualitative research in a more positivist manner, right? Because they would think that, because for us it starts, what is your research question? Where does it come from? And why do you need to do this research in this particular way? How do you recruit your participants? Why is it relevant? What potential biases could exist in the recruitment? How could you avoid that? So we get into all those discussions. So, and those discussions I would not have had if I had remained only within anthropology. So the way I teach qualitative research methods is about communicating qualitative research in the same manner that you would communicate quantitative research also. So that it's at the end of the day, as you said, it should be problem oriented.
And population descriptive, not just the one slice that you happen to see.
Exactly. So how can you rise above the description? How can you say, yes, this is relevant. This individual's life story has a lot of meaning that it brings, but how does that meaning reflect and connect to broader societal issues that exist? Most often what happens, people come up to that description and they stop.
Right.
And so then for a qualitative person, that's an interesting story. So what? That so what is the responsibility of the researcher as well to go to that higher level to explain that thing.
Oh, that's really interesting. Again, I'm just pulling parallels. So when I went to Indiana University for the first time, I was working in a center which is called CITEC, Center for the Studies of Institution, Population and Environmental Change. So the population was the demographic part. And we had a project, we were looking at Honduras and Guatemala. And both of these places, there were a lot of change which were related to the indigenous tribal communities living there, then a lot of urbanization and this mix of people coming in, and colonization, and all of the other past lingering signatures on the place, and economy and markets. And so we had an economic geographer. She was doing spatial econometric models. We had a landscape ecologist who was me. We had someone who was doing remote sensing on change, and we had an anthropologist. And we realized there was such difference because the spatial economic modeler, she wanted to put numbers on the landscape and create a model. The anthropologist was very clear that she said, I know this northwestern corner, this community, I am not willing to extrapolate to the rest of the landscape. It makes me deeply uncomfortable that you're creating these extrapolations because I can tell you I know only about this landscape. And so methodologically, we were sort of grappling with this, that how can you integrate anthropology, demography, and spatial modeling, and each has its own.
Yeah.
It's not easy, but we need to find ways.
In some of our research projects, we look at, so you can either go from anthropological insights and to design that to look at broader perspectives, like the survey questionnaires you design, for example, or things that you would like to observe. For example, if there is chikungunya vaccine that is concentrated in a particular way, and you want to look at, okay, why is it concentrated?
You mean some are taking it, some are not?
No, for example, our work in Curaçao, we focused on mosquito-borne diseases, and chikungunya is one of these things, right? Or dengue, or Zika, for that example. When we saw that dengue and chikungunya were more endemic in particular sites of the island, from a spatial epidemiological point of view, you can just point to that map and say, here, it's more endemic. But it is the anthropological insights and the community insights you need to explain why over there. Because we saw that there was a lot of waste dumping that would happen over there. And due to rains, water collection points were there where larvae would grow more. And there would be, and these lower socioeconomic groups most often lived around these waste dumping sites. These are illegal waste dumping sites. So then you could explain that it's not that because of socioeconomic conditions they are more vulnerable to the virus, but it is the ecological element as well. And that's that connection that we often miss out, that we focus so much on the immediate living context and forget the ecological context in which they're.
Which means you would say things like, oh, the poor are dirty, but then they're
exactly, and they would, they're illiterate. They wouldn't know how to do it.
But if they're exposed to bad ecologies, what can they do?
Exactly, and it becomes very simplistic to say, oh, they are unaware or unknowledgeable about certain things. They may have all the knowledge, but what if they live in areas which they cannot control or change? And that's.
I think that brings me to one of the questions I wanted to ask you. So when you stayed on in the Netherlands after your PhD, which areas did you first start working in, or even for your PhD, where were you working? And what dictated the choice of locations?
Yeah. So this is not really a question of struggle per se, but when I did my master thesis in the Netherlands, in my second master's, I focused on risk assessment of HIV/AIDS among migrant laborers from North Karnataka and Goa. So I did research in Goa. And they liked the master thesis so much that they offered me a PhD position to continue working on that topic. So I stayed there for, I did my master's in a shorter duration. So it was 24 months. I finished it in 18 months. And then I went started my PhD. And then I came back to Goa to do a larger study focusing on multiple groups. So I focused on fishing communities, focused on truck drivers, construction laborers, because these were all the occupations
exposed to HIV.
no, they were all occupations where North Karnataka laborers were coming into.
Okay.
And at that point, these laborers were coming from Bagalkot, Bijapur, that was areas because those areas were experiencing drought conditions. So these were farmers who were forced out of those occupations and they would come to work in Goa.
And which is sort of why I asked you the question, because I'm thinking, again, from your anthropological background, you started with the North Karnataka interest that took you to Goa. Why? How do you then get to Curaçao and all of these other interesting places?
I think it just goes from this part that this element of inequality, the element of being mistreated by this thing. Because even in Goa, for example, that there was migrant labor. At that time, the AIDS Control Society thought, okay, it's again, those illiterate people don't know how to deal with it. It was not about being illiterate. It's about the conditions that they were living in, what knowledge they had access to. Why was it not presented in Kannada, for example, as opposed to Hindi and other elements? So similarly,
the health information was not given to them in their own languages.
No, because there were also not many people in NGOs who spoke Kannada over there.
Right.
And the Kannada that people from Bagalkot and is very different.
Yeah.
Right. So I remember when I did my PhD research in Goa, that sometimes I would be the only one in those NGOs who would be, because I worked a lot with NGOs in this community, because for me it was very important at the end of my PhD to contribute to the prevention efforts by the NGOs themselves. And that from an early stage of my PhD, I made it quite clear that there needs to be this kind of co-production of knowledge that can feed back into those campaigns. So that kind of started that process of looking at why these migrant groups, in what kind of particular contexts. The end of the PhD, I then brought the results from the PhD back to the NGOs to say, these are what I've found. What can you or we do about it? How can we integrate it into ongoing programs to make it more sustainable and this kind of thing? So that was the PhD journey. In addition to publishing articles and all that stuff, that for me, this was also equally important.
And the PhD program was supportive, or were you unique in that?
The PhD program was quite supportive because my guide, Professor Inga Hutter, she also had done the similar kind of process. So she also had worked in North Karnataka, actually in Dharwad. And she had also converted her research into an intervention program for women on nutrition during childbirth. So that kind of was also, she's also kind of a role model of how research should not be done for research's sake, but should contribute back to the community in that sense.
Which is fascinating, because that's exactly the kind of mentors. Again, I mean, I did my PhD with Madhav Gadgil, but a lot of what I sought in him and got from him also was this whole idea again that you don't do your research in isolation. Especially if you're working in health and ecology, you have to do something that connects back to action.
So so after my PhD, then I wanted to, I got a chance to have a 4-year postdoc at the same institute. With the idea of developing new research projects. So then I branched out a bit more to focus also on, at that time there were a lot more Indians who would come to the Netherlands as skilled migrant visas started up. So I started to also focus on migration, of skilled migration between India and Netherlands, then looking at how these different groups again face inequalities, how a nurse experiences migration is very different than a person who comes to work for Philips, for example.
Okay.
And in what areas do they come to work? For example, we did a project on nurses in northern Netherlands. They were coming into depopulating regions. So because of the health workforce aging, that they had to either close down on operation theatre or bring nurses from Bangalore to work there.
Wow.
So it was a huge thing at that point because generally healthcare personnel do not come to Netherlands from India because they would go to UK or the Commonwealth in that countries in that sense. But because there was a shortage, they brought them there, and then they um, started to train them in the Dutch system, because a lot of our medical education is still based on this British system, right? Whereas the Dutch system is very much based on a protocol, on a system of connections between particular groups, on more intra-professional communication and this kind of thing. So I was really curious, how do these care light nurses then manage to work within these things? So I did a project that was also part of my postdoc.
And from Malayalam, just thinking of the rolling tongue versus the guttural Dutch. It's a very different language,
That's true.
Phonetically,
Yeah.
the way you move your mouth is very different. And
So within the postdoc period, I think my focus again came back to these inequalities, but also from the other side in the healthcare system itself. Because previously I focused on the community's access to healthcare system.
The recipients of health, as opposed to
and then I
providers.
from the other
Right.
side. How does that work?
And by then you were fluent in Dutch. How many languages do you speak?
I speak 6 languages. So Dutch I learned when I was doing my postdoc. They said you can teach in English in a bachelor course on migration, but if someone asks you a question in Dutch, you should be able to answer. So then I did 3 intensive courses and then started to learn, speak Dutch and learn and interact with people. I'd learned German in school in Dharwad, so that helped a lot.
German in school in Dharwad?
Yeah, because Dharwad or North Karnataka, that part has quite a strong German influence.
I didn't know that.
Yeah, there were German missionaries who first came there. The first English to Kannada dictionary made by a German priest.
I forgot all about that.
So if you, for example, if you go to a Basel Mission church in any of these areas, if you open the hymn book, the first line is still in German.
So it's German, English, Kannada, Marathi?
Kannada, Hindi, Tamil, and Marathi.
And Dutch.
Marathi, I would say, Dutch as well. But Marathi I can understand, but not
6 plus a bit.
6 plus a bit. As with most of us. Right.
Yeah, that is it.
Yeah. So it's language for me is a way of attachment in a sense. It shows also belonging.
Right.
It also shows ways that you want to connect people. It's not about excluding, it's more about including in that process. Yeah.
Food and language.
Food and language, yeah.
Very interesting. No, it's a very different, I think anthropology is one of the things that I think you need a skill for, right? You need to have a human touch, so to speak. No?
It is a human touch, and I think it can go a bit further to also speak about, and it asks from you a very high level of empathy, which you may not have when you start studying. Right? Because if I think to the time that I started studying anthropology, I would have not seen myself being that open and that empathetic to different contexts. That you immediately don't start putting your frame of mind onto people, but rather open to other frames of mind into it.
And that's not easy.
It's not easy.
No.
That's not easy. But at the same time, not doing it is also not an option.
Yeah.
Right. That because then we start, in the research that I do at least, that we start to being too judgmental of people and looking at them only from a one particular perspective. For example, when I also teach qualitative methods to public health professionals. So the first task for me over there is really to tell them the person sitting in front of you is not just a patient. Is a mother, is a office goer, is a person coming from a particular background, is a person who has a whole history of these things, who's dependent, other people are dependent on her for this thing. So when you understand the person sitting in front of you is not just the disease of that person, It's the person you try to understand. So when you teach qualitative methods, it's about understanding that person, because by understanding that person, you get to know so much more about why that condition is progressing or not progressing, how you can help the person go further into that process.
And the person itself, I think, recovers faster beginning because you've seen them as a person, right? I'm just thinking about aging, which is something that you study so much. My mother now is 88 and can't hear so well, but is fiercely intelligent.
Yes.
Okay, and I think in many ways sharper than me even at this age, right? But I take her to the doctor's office. They see old person can't hear. Start thinking, therefore, that she's mentally, her cognition is low, and they start speaking to me. They ask me about her. And she's visibly frustrated because she can't hear, she doesn't know what's going on, and I keep turning the conversation back to her. She can hear if I speak to her. She knows how to interpret my voice. Many doctors don't have the patience, but the ones that do, I find she recovers much faster because they're seeing her as a human being and she can actually tell them far better than me how she's feeling. It's her body. But you wonder why such a big, we don't teach public health professionals, especially doctors, for instance, somewhere this idea of empathy. I think it's become so science oriented. My mother's father was a doctor, so we can actually see the evolution of the medical field in some sense.
One of the first assignments I give in my courses to public health professionals is to go out of the hospital. Go outside, stand there, and look how patients arrive to the hospital. Just observe. Don't judge. Just observe. Don't make sense anything. Just observe. Because how they come, with whom do they come, what is their body language, how do they enter into the hospital, if someone is new, how you can see anxiety on their face, on their behavior, and this kind of things. Through that you understand so much more about the people before you start to look at what their conditions are.
True.
So sometimes when we work within, maybe it's also true for us as academics, that we work so much within institutions that we become focused only within the institution. We don't see what is happening outside the institution. So also for our students in development studies, we say it's non-negotiable not going to a global south country to do your master thesis. So because unless you go there, you wouldn't know what development means.
Right.
Similarly for the healthcare profession, unless you go out and look in the community, look outside the hospital, you don't understand the barriers people face to enter a hospital.
Again, just a funny story, but I think it relates to what you say. We had this, our masters in development students go to places for internships and they come back and report. They do research projects also. But one of the internships, there was a farmer who had this intervention, which is coconut shells. You put a small hole in them and you put them in the ground. It's like drip irrigation. Fill them with water. And it slowly percolates in, and it was actually water staff part of Andhra Pradesh. So he became a famous farmer, and this boy went to document this. There was another girl student who also went along to look at something completely different, but she ended up staying in the same farmer's house because it was a good base. But because she was a girl, the farmer's wife slept with her in the kitchen. And in the Viva, it was very interesting. The boy talked all about farmer success, amazing intervention. The woman said, what is there with him? He keeps going to Hyderabad to be feted at functions, and he eats biryani. Because this coconut shell, it's a small hole. It gets blocked with mud. She said, meanwhile, I am on my hands and legs all day scrubbing dirt with this toothbrush, scrubbing coconut shells with this toothbrush while my husband is eating biryani in Hyderabad. That's when you realize the gendered nature of farming, her drudgery, her housework, who gets the recognition, that this is labor intensive. He doesn't see it. And only by accident, because this girl happened to be spending time with the farmer's wife, and it was not part of her work at all. But it really makes you think about how much we see, we don't see, barriers, right, in every way.
And who benefits and who gets left behind. A lot of my work now also focuses on the invisible labor that women do within caregiving within households. So in this large study that we did around aging in immigrant households, we did this in Kerala and Karnataka and Goa as well, because these are the three states which are experiencing faster rate of population aging. There we see is that older women are not only caring for their spouses, but also for other older members who've been brought together because they cannot manage on their own. Often that the older women pays a greater price of this because they are caring for a larger group of people as well as aging themselves.
Right.
So, and when my grandchildren are visiting, they can come and go, but then on everyday basis, there is not many people available who can provide this care. So then how the non-kin or non-family members, neighbors also become such an important element of this care landscape that exists. So care is often associated only with family, but in these contexts where these communities are aging, there is out migration. There are very few family members available for care. The care landscape continuously seems to evolve over there.
And would you say it's similar in the Netherlands, or I mean, one can't universalize to South and North context, but here, I mean, how much would community step in? How much would it become institutional support for care in the Netherlands?
In the Netherlands, also they face inequalities in access to care, but the advantages there, they have mechanisms where the insurance and other kind of agencies help older adults access these everyday things. For example, there is something called as thuiszorg or care at home. So there is a person who, depending on your condition, that person would come 1 or 2 hours per week to help you at home to clean stuff or to do something for yourself. The idea is they want to keep older adults at home as long as possible, as long as they can manage themselves. And they would provide all these kind of services to keep them home.
Which is very nice because you're in your situation as
Exactly. So
they can be your mental faculty.
Exactly. So that is what they term as aging in place.
So it is very place-based.
It's very place-based. And I think in the Indian context, of course, these services are not so freely available, or it's, of course, in cities like Bangalore, you can, I remember we talked about this earlier, is that you can call and ask for care, but there is no guarantee that you'll receive it. That sense, right? But imagine entire 2 towns like Dharwad or Hubli or this kind of thing. There, finding such care would be even more difficult. But then life doesn't stop. They have to go on, they have to look for other ways in which these care is managed. So I think in these states, you will see more and more how different family groups of family, non-family members would come together to coexist within this system. And that's
so informality takes the place of some systemic function, which is so much the case of anything here, no traffic or pollution. We manage because of
there's no other option.
there's no other option. There's no other option.
Yeah. And I think what I really admire, and every time I come to India, is the pace of change that is there. But at the same time, how much of the change is packaged and presented also as being part of the local culture or the context in this. And sometimes you also find that change happens so fast that because we often think all older adults are reluctant to change, but that's not always the case. If you look at how many older adults use WhatsApp,
yes,
right? And how many of them during COVID, right? That was the time when you may think about digital exclusion and say, oh, older people don't use it. But that was their lifesaver.
Yes,
actually, in that time. They could order groceries, they could get things delivered home, they could support each other.
Yes.
They may not be able to type, but a very simple thing like a voice sending voice notes to people. You can think, oh, it's just a technological thing, but it has a higher emotional value because you hear the person.
Yes.
By hearing the person, what we call with anthropological work also is this idea of co-presence. The person is maybe living in the US, but by hearing that person's voice or seeing that person, you recreate that sense of presence within your own household. And for an older adult who is isolated, who is ill, or that's a very big comfort.
That's true. Yeah. I'm just thinking of, since you work on planetary health, and that's something we don't think of as much. Health is so omnipresent. In that sense, it's like history. It's one of the things everyone has an opinion on. Very few people are informed about. We all have a moral stance on these things, and but what is planetary about the health work that you do? That
So again, as another challenging element, because as you have heard so far, I'm not very satisfied remaining in a particular place. I constantly look at what new things can I learn from this process. So if you look at from anthropology, when I went into health sciences, it was about understanding this cultural context that played a role in people's healthy behaviors or non-healthy behaviors or whatever. That understanding that context and thinking, if we change the context or speak to people within their own context, they will be able to, if they want, they can change behaviors. But when that was the time when I was in anthropology and demography, this was the main thing that led my idea of how can we change behaviors, how can we understand behaviors, and this kind of thing. When I came to Utrecht, that is this faculty of geosciences, there's a lot more work around ecology, among climate change and this kind of thing. And that really struck me as that we do so much work on communities, on their cultural context, and we often forget the ecological context in which they live. And that kind of challenged me to think about, so how does extreme heat actually influence these processes? How does extreme weather events play a role in mosquito-borne diseases or in terms of not being able to access healthcare services? We knew it played a role, but we never thought about it. We only when we think about barriers, we think about income barriers, we think about social barriers or cultural barriers in accessing care, but ecological barriers are also strict. Right? They may have all the knowledge that they need to go to a health center. They may be able to afford it. They may be able to convince someone to take them there. But if they cannot go out due to extreme heat or to extreme rain, monsoons, like roads being flooded and everything, then they're still not being able to access.
Or an opportunity. I'm just thinking again, our informal settlement work in Bangalore. If you think of like 2-3 things, one is a tree, just a people tree or something in the center of the slum, is that's where women will sit together in the evenings and chat and exchange, and just having that place of community to share is what creates that bonding. Or all of these places, you must have seen this also, in a place which has nothing, no water, they will have paint buckets and all kinds of things on the roof, growing some plants, and that is your nutrition, your ginger tea, your tulsi, something for a headache, which it brings resilience and keeps you out of hospital a little bit longer.
Exactly.
Right? So ecology, I was struck by this once as an ecologist looking at this. I saw a paper looking at informal settlements across 3 cities, and they had characterized what do they have that is help assets. Assets, that's the word I was looking for. Assets are only motorcycle, mixie. Assets were not ecology, but ecology is a daily asset for them. You ask any woman in an informal settlement, she'll have a small garden. But I don't know.
I'm smiling because I'm reminded of something. I did this project on older adults, Hindustan's older adults. These are Suriname older adults who are of Indian origin from generations, who went from West Bengal and takes towards Suriname, that was a colony of Netherlands. And they are retired. They came to the post-independence. They came to Netherlands to work over there. And this is a group that is now retired, or in the last few years has been retiring. So they are moving into what is called as they're leaving their family homes and moving towards woongroepen. It's like co-living. So they get an apartment. It's a 1-bedroom apartment, but everyone living in that co-living house or complex are all older adults of similar ethnic background, for example. So for us, it was interesting to find out how do these people who have never lived outside their family homes recreate home over in this new setting. And some of the women, for them, it was the first time in their lives, these are 65 plus women, right, had a chance to decide for themselves what their home would look like. And they had complete control on where they would put their mandir, where they would keep what kind of food they would cook at home, what is not allowed, what is allowed, and all this kind of things. And one of them, I remember we had this meeting, and she said, I miss my garden. And so she had kept, so for her puja, she needed flowers. So, and of course, not all weather is
Yes, in Netherlands.
it's context. But she had all these pots outside. And she said, for me, I came from a household, and she thought back of her childhood in Suriname, where she had a lot of land, home was around a lot of big garden, and there was a lot of leaves. And she said, in at this age, these pots remind me of my childhood and how important those pots and those plants were for her to not just recreate home, but also to recreate the sense of belonging to these things. So when you spoke about this thing, it's both physical well-being, but also emotional well-being that these plants bring to those particular groups. Yeah.
I have a colleague, Seema Mundoli, and she's been studying the Ayankali scheme in Kerala, which is basically an income generation scheme like the MNREGA, but for urban areas. And one of the things they allow you to do is you can grow gardens, either community gardens or in your own house, and they will pay you for the labor component. And who takes it up? Typically, it's women who have small children and older people, who can't. So, because if you take construction labor or something which is road labor, which is also under the same project, you get more money. This you get a little less money, but you can keep your children with you. It's not that strenuous if you're an older person, right? So, but who would take it again is people who are income starved. So their lives are fairly bleak because it's always a struggle. They all said that the sight of something growing brought them joy. And it's well beyond, the income, the food, the nutrition. It's just the fact that in the middle of that very difficult life, you grow something, you see a flower, you see a leaf, and it makes you happy. There's something positive in that. And I think we forget the intangibles, coming back to the planetary part of it. This is probably the connection with the planet and the place and the people, right?
Yeah. I think within planetary sciences or planetary health, so they often forget the agency of communities, the agency of people. You can, of course, there's a lot of doom messages that come up, but there's also a lot of messages of opportunities. There is a lot of message of hope that these communities also bring to this particular thing. I think from a planetary perspective is really to look at equity and justice issues, but also the ability to bring about change. And that's what I bring to planetary health.
Right. No, and this is, I think, fascinating for me also, because I think, on the other hand, if you look at ecology, so much of ecology is related to health, and I think as ecologists, we don't bring in the aspect of health. I don't know why these are separate disciplines in that sense. They seem to be so interconnected.
For example, when we studied anthropology, we also studied about sacred forests and how the importance of sacred forests, importance of like animals and everything when we did a household census, for example. But over a period of time, we leave out those things from our theorizations. We leave out the importance of those elements and how non-human interactions are in such a important element in constructing that sense of well-being. I think within planetary health, of a focus again, because it's such a transdisciplinary initiative or a discipline in itself, that a focus should still remain on how this kind of coexistence is necessary to continue the.
Exactly.
It's not at one benefit of the other.
Yes. It's not one over the other, but really both feeding into each other.
Yeah. Like during the time when you visited Utrecht, these were also the kind of discussions we had then, right?
Exactly. Yeah. So that brings me to one sort of, I think, final question. As someone who's seen a lot of change, Dharwad, Utrecht, you come back and forth to India very often. You see the changes in India. You see a lot of changes in different parts of the world. Again, you working in Curacao, we were talking about all of the changes there with, cruise ships. And I would say, as a parent as well as a child of aging parents, what are your hopes and wishes for the world going forward with sustainability, and what are the fears that we should, and ways forward that we might be going into this The very difficult part, but what do you think can take us out of it? The question.
Good question.
Yeah.
I think at the core of it, as I said earlier, is having empathy towards others, being more understanding of the processes, because sustainability initiatives sometimes become too individual focused, or they're focused too much towards the privileged group, forgetting the other elements that play a role in that. That you need both these groups to work together in that process. I think my hope, of course, is that communities in future would actually recognize the importance of what, say, for things around water quality or air quality, of that. They recognize the impact of it, that it doesn't remain, oh, it's an interesting paper, but as academics we also make that extra step to go out on the street and speak about how does this, bursting that cracker have an impact on air quality, on asthma of your mother who would have this kind of thing. So making it real for people, for them to understand, because it's also our responsibility as academics to bring that to that level, to make people understand that all our choices have an impact.
There are consequences.
Yes.
Yeah.
I also have hope, because I think younger people are much more aware compared to when I was in college or was in school, that they are able to bring about that change. And I hope by these co-production or co-creation activities with communities, we can see that change.
That's lovely. I think one of the things that I will really take away from this conversation is the importance of empathy and the importance of talking to people, and without your biased frames, or to the extent that we can dismantle our frames of bias to understand why they come from where they come from, and but also then finding ways to get out of that and link it to broader issues and come up with solutions that people can take forward themselves, I think. Yeah. So thank you so much,
Thanks so
Ajay.
much
It's
for the
been
very interesting
really,
conversation.
yeah.
Yes.